So once again, you're all welcome back to this mock OET mock review. So we are going to start from the doctor's case note. I think this was the case note that I gave you guys. Let's see. I think what you guys should do is to like go through, you can just open it on the Telegram group. I think it will be easier that way instead of trying to follow it up with me on here, because you might not see it clearly, or you can follow it up on the Telegram. So if you look at that writing task, the writing task says, using the information given in the note, write a letter of referral to the orthopedic surgeon, Dr. Brown Clark, address the letter to this. Yeah. Now, usually when a letter is given to you, you first of all watch out for the writing task. In this writing task, we are trying to watch out for the purpose, but the purpose is not clearly stated in this writing task. What you want the reader to do for the patient is not clearly stated. So what we now do is to go for the plan of the day to see if we can like figure out what the purpose of this letter is. The plan, the first thing is referred to orthopedic surgeon for assessment and management of osteoarthritis. So the purpose of this letter, why we are writing this letter to this orthopedic surgeon, is for the orthopedic surgeon to assess and manage this patient for osteoarthritis. Now the question will now be, what is the problem? Although they mention osteoarthritis, but we want to like get the full picture of what the problem is. Now let's go back. If you read from the beginning to the end of this case note, you can see they finally made an assessment that this patient is having worsening of chronic osteoarthritis with significant pain. So it means this patient is having worsening, increasing pain, or worsening of this osteoarthritis, which is now affecting his activities of daily living, yeah, with signs of depression. Do you understand? So the problem on ground now is that this guy is having increasing pain, yeah, worsening osteoarthritis, and is significantly negatively affecting him physically and psychologically. So don't just state that, the problem here is for, like some of you were saying, Baker's cyst of the right knee plus worsening osteoarthritis as the problem, because that's what most of you will always do. They will just go copy the diagnosis and use it as a problem. Sometimes the diagnosis might not describe the problem very well to convince this reader why this patient will be needing further a specialist intervention in this case. So if you are saying Baker's cyst in the right knee plus worsening osteoarthritis, and telling the reader that this osteoarthritis is worsening and is having significant pain and is affecting his activities of daily living, which is like the physical activities, and also depression, which is like the psychological, negative psychological impact on this patient. That makes more meaning to this purpose of this letter than you saying Baker's cyst in the right knee plus worsening osteoarthritis. So these are the two things I'm going to use in my introduction. Now, I'm going to let this reader know that this chronic osteoarthritis this patient is having is worsening and is now affecting this patient significantly, physically and psychologically. Do you understand? So this patient will need a specialist, a surgeon's assessment and management. Perhaps, because if you look at the other suggestion they said here, that all those ones will now come in your recommendation anyway, when you're not giving details of what you want the reader to do. You can now bring all these other suggestions that you will be needing steroid injection. You also need a physiotherapist to improve your joint mobility. And if possible, a district nurse can be invited to assess this patient home to see if it is suitable for this patient to live in. Do you get? So you have to be writing this thing in a clear terms. These are the things you bring in the recommendation now. Now, if you've gone from the beginning of this letter, you will discover that this letter is not an urgent letter. Yeah, it's not an urgent letter. And if you look at the background of this patient issue, it is directly linking to this patient problem. So that means you are going to start this letter, discussing this patient's medical history. Yeah, as when we talk about the medical history relating to this issue now, which is the osteoarthritis and when the osteoarthritis started, what was done in the past concerning, because he has had even hip replacement before in the past, and even lumbar lumenectomy in the past of L5 and S1. So these are the things you bring in under the background before you now start telling us how this issue now started. I think for the past 1 year or thereabout, the pain has progressively worsened or something like that till how it is now. If there is any other background you want to bring in, like the hypertension and the rest, you can bring them in if you want. Then, and finally, you now make your recommendation. Before I project my, okay, first, let me project my letter, how I wrote this first, before we now look at entertain questions. Now, this is my address. Usually, I write the person's I'm writing name first, and then write the person's occupation or designation, this orthopedic surgeon, before I will now write the address in full. And then this is the today's date according to that case note. This is my greeting, and then this is the real line or the heading. Now, in my introduction, I don't know if you guys can see this clearly, but let me try and zoom it a little bit, yeah? So in the introduction, I said, I am concerned that Mrs. Santini's bilateral knee joint pain has increased significantly due to worsening osteoarthritis with associated Baker cyst on the right knee. I'm referring her to you for further assessment and management. The osteoarthritis has taken a chronic course. Now, I want to summarize the background information. The osteoarthritis has taken a chronic course since 2003 and has had other joint problems necessitating lumbar lumenectomy in 2008 and bilateral hip replacement in 2010, which helped to ameliorate her pains and improve her functionality. She has been on glucosamine 1,500 milligrams daily. However, the pain has become more intense. Now, I'm going to the current situation now, how the problem is affecting this patient currently. Yeah. However, the pain has become more intense for the past 6 weeks, aggravated by movement. A soft lump was also noticed on the back of the right knee 4 weeks ago, worsening the pain and reducing joint mobility. This has negatively impacted on her ability to carry out activities, out daily functions and social space, resulting to progressive depression. An MRI carried out shows degenerative changes, while her examination findings and blood tests are unremarkable, except for concomitant crepitus observed on mobilizing the joints. I believe Mrs. Santini would benefit from your further review and treatment. This is like the first thing. You don't just stop there, just like what many of you did in your writing. Some just wrote only this one and ran away and stopped. You have to write in details all the recommendation, everything you want for this, so the reader to do for this person. I would suggest a joint steroid injection, and if possible, a district nurse should assess her living condition at home. A referral to a physiotherapist would also be helpful. If you need further information, please contact me. Now, I want to modify this a little bit significantly due to worsening osteoarthritis. Okay, before I modify it, let me just hear from your own, because different people wrote this thing in different way, of which the one I will like the most is in this introduction, trying to bring in that this has actually, although I use, I made it very clear. If you see if you look at the vocabularies I use here, increased significantly, that the joint pain has increased significantly due to worsening osteoarthritis. So I'm trying to like make this problem very clear to the reader. In order to still emphasize on this problem, instead of me adding with an associated Becker cyst on the right knee, I can bring that in the body of the paragraph and substitute it here with increased significantly, negatively impacting on his physical and physical activity and mental health. I can put it that way in the introduction. So I think that one will carry more weight than using this other part of this. All right, I think one person wrote has like that, which made more sense. The person that scored, okay, I think the person that scored the highest in this writing was Opeyemi. Yeah, was Opeyemi. She got 308. All right, so from what I've written now, for those of you that are doctors, what do you have to say compared to what you've written? What do you think was your major challenge? Because here what I did was to like write the introduction, yeah, by bringing in the problem. This is the problem here, highlighting it, and then bringing in the purpose of the letter. Then bringing in the purpose of the letter, which is to assess and manage these patients. Now here, immediately I went in to describe the background information. Yeah, I went in to describe the background information. Now this is the background information. Why I'm bringing in the background information is because it's directly linking to the problem we are discussing now. It's still the osteoarthritis we are discussing. And this osteoarthritis actually started long time ago. Although it was affecting more of the hands and feet at that. Okay, no, it's not this particular case. So although it started since 2003 at that point, okay, and some things were done, they've done a hip replacement, they've done lumbar luminectomy, which actually helped until about 6 weeks ago, when the whole thing now started again. So here, what I've actually done here, this glucosamine that this patient is on, yeah, I can actually, because it's still part of the background information, I can actually bring it here to be part of this, my background, to now be the last sentence. But I'm trying to like paint a very clear picture for this patient. I picked it to start this sentence to have said that she has been on this daily, letting this reader know, not that this patient is not taking drugs. She has been taking this drug to help with this. However, the pain has become more intense for the past. So you see how I create the picture to this reader to convince this reader that this patient will need to be assessed. So I've advocated for the past 6 weeks, and the soft lump was also noticed on the back of the knee 4 weeks ago. That's the Becker cyst here now, worsening the pain and reducing joint mobility. This has negatively impacted on her daily activities and function. So I'm kind of now summarize the whole problem and then state clearly how it's still my clinical findings. Yeah, that an MRI was carried out to still convince the reader why her examination findings and blood tests are unremarkable, except for concomitant crepitus observed on mobilizing the joints. Now, if you look at this, my letter writing now, you can observe that after the introduction, I moved to the background. After the background, I started summarizing treatments so far. Yeah, I can actually stop this here and then start my current situation. The treatment so far, so to say, is kind of overflowing into the current situation, so to say, because this started like for the past 6 weeks. Do you get? There is really no like a new visit again or anything to show how the patient is. That's how the patient issue has always been till now. And I now continue after saying what they call it, what the issue has been for the past 6 weeks, yeah, and how it has affected this patient. And now still buttress it with the results, what the MRI carried out is showing currently regarding this joint. Finally, when I was making my recommendation, I made my points very clear. I didn't just pick one of the points. Your recommendation is usually your plan, details in the plan, or just what you want the leader to do. And this further buttresses the purpose of the letter because you are saying for assessment and management. So these are the things you want this person to. You want this person to review and manage. And in the management, you're already giving suggestion of what you think that will help. Because there is question mark there, that's why I said I would suggest, because there is a question mark in those plans, I would suggest, and then I say, if possible. Do you get? But for the physiotherapist, there is no question mark. I just said a referral to a physiotherapist would also be helpful. If there was a question mark, I can say something like this. I would also recommend, if you think it's possible or if you think it's necessary for a physiotherapy to, do you get? If there is a question mark, that means you are kind of making a suggestion. You're not very sure. Is this something we can consider doing? Do you understand? Or you can say, I would also recommend you consider referring this patient to a physiotherapist, which I believe will be helpful. So you state your facts, your recommendation to the patient to be very clear. If you need any further information, please contact me. Yours sincerely, GP. Some persons, one person wrote something like, the GP did this review. You are the GP. Always read the tax very well. You are the GP. It's not as if another person review and you're not writing the letter on behalf of that person. Do you understand? Do you have any question regarding this letter? Do you have any question regarding? Oh, baby, I think in your recommendation anyway, you omitted one point, yeah? Was it in your own recommendation? Any questions? Can anyone hear me at all, or have I been talking?
Yes. Good evening.
All right. Good evening. Yeah, Sonny.
I don't know. Is my own part of the? Did you mark my own too?
I didn't mark your own because you submitted your own letter. Was it today you submitted your letter? And I've already finished marking. I've already finished marking. I've already finished marking before you submitted your letter. So just use this review to like reflect on what you've written and see how you performed. Yeah.
I wish I can mark myself.
Hello.
If I have time, I can do it for you because I already have a letter that I missed. That's Amina's own. But on a normal day, I won't want to go back to that letter because I also have other things I do. But I will try to see if I can mark it. Yeah. Amina, go on. Yeah.
Okay. Thank you very much for the review. It's quite educative. The issues I think I'm having is confusion and overwriting, because in the instruction we were to write not more than 200 words, but at the end of the day, it was around 216 words I wrote.
This is not IELTS. That's what I used to tell people. This is not IELTS. Yeah. This is not IELTS where you are kind of, they've already suggested that you write between 180 and 200. You know, there is what they call conciseness in your marking. This case note, they are standardized in the sense that no matter how long you will always write or how brief you always be, if you actually pick the important things in that case note, your word count should always be between 180 and 200.
Okay.
Let me see what my word count is here. But the thing is, some person can still write because you're not still very perfect in the writing. I might still get up to like 220 or thereabouts in that writing. Like now, if you look at my own now, you know the word count is from the introduction. My own word count now is telling me 203.
Yes.
Do you understand? So 203 is fine. I wouldn't say I overwrite. 210 is fine. I wouldn't say you overwrite, so to say. But the more your stuff is getting above 200, it means you are most likely you'll be adding some things that are really not relevant in that writing. And the more your writing is getting far below 180, it means there are things you're already omitting in that you're supposed to have added in that writing. It's just as simple as that.
Okay. Okay, thank you. The according to the tutelage you have rendered, you actually said after the introduction, we go straight to the medical history. If there's a way we could sandwich the medical,
not straight to the medical history. There are 5 parts of your letter writing, which is the introduction, the background, the treatment so far, the current situation, and your recommendation. These are usually 5 parts. So the background. The background, most of the time, will include your social history, your medical history, if they are relevant in that writing. Your treatment so far is the summary of how the problem first started, the presenting complaint, the treatment you've given so far. Then the current situation is how the condition is doing now. Most of the time when you have this, when those two are split, and when you have a patient having several visits, you will now be able to have a clear demarcation where the current situation will be and where the treatment so far will be. Then you now have the recommendation. The recommendation is the last part of your writing. Yeah, the recommendation is the plan, what you want the reader to now do for this patient, which is in my letter is this part. So there's where you now give detail and explain what you want. It's not just for you to just copy all the main thing and just say, in view of the above, Ms. Martin will benefit from your review and treatment, and you run away. There are other things in the plan of the day. You have to add them. These are the recommendations you are making. Do you get?
Yes.
Now, if you look at my own writing now, if this were to be urgent letter now, the current situation will be coming immediately, but it's not an urgent letter. It's a cold case. And because it's a cold case, I can actually start from here, the treatment so far. This is my treatment so far mixed with my current situation, because there is no really demarcation. It's just only one presentation that this patient has. Do you understand? So if it was urgent letter now, this would have come immediately after the introduction. But this is not an urgent letter, it's a court case. And because it's a court case, the treatment so far supposed to have come first, but it's not still coming again because I'm having my background, which is directly leading to this person's problem. And the only part of the background that I picked are those ones directly relating now. But if you also add that the patient, this man is hypertensive, and it's also very fine because these are chronic issues that might affect this person having surgery or the other. So I think that information is actually important to add in this letter. If you are to add that information now, you cannot bring it up here. You can bring it just before your recommendation. Do you understand? All those other less relevant this thing. So the way this thing is always organized, in all your letter, introduction is always the first. And introduction will contain the problem and the purpose. Yeah. This is the problem. This is the problem. And then this is the purpose of the letter clearly stated for you. Then the last part of the letter is your recommendation. Sometimes this can be 1 paragraph, sometimes it can be 2, it can be 3, depending on the amount of information you are adding. Do you understand? Will be your recommendation. Now, the remaining part of this letter writing here is both my treatment so far and my current situation. Is kind of, because I have summarized how it all started and how this patient condition is now. I summarize them together. But in some case notes, you may have where you have like 2, 3, 4 visits. So in that case, you might just decide to summarize maybe the 3 visits as how the whole issue has started. And then the current visit, maybe there's a visit today that's explained a lot of things. You now make that one your current situation. But in this case, we just had only 1 visit, and it's explained both how it has been and how the patient is now. So I now have to like organize it in this pattern. Then bringing this background before the treatment so far, because it's what is causing this problem we are having now. I don't know if you get Amina.
Yes, I do.
All right. Any other question from the group?
Thank you. Actually, the question I wanted to ask, or for you to clear the air, is that in some of during my notice in some of the questions and answers, yes, the way you arranged it, but there's one thing you mentioned that actually solved the problem was that the relevancy of whatever it is, because some of those practice answers would, some of them, you see them talking about the presenting complaint today before they even go into the past medical history.
Okay.
Yeah. Why others, they will start in our own pattern. That is the pattern you have taught us. So at the end of the day, you don't even know which one to use. Which pattern? Do you use this pattern or you use the other pattern? But you said something, how relevant that information is.
Exactly.
So,
how relevant the information, that's how you organize your work. Do you understand?
Okay.
So this
Okay.
background is very, very relevant for this reader to understand the situation, what is going on. Do you understand? It has been since 2000, I've even done something. So it has to come here first. Before you now go on to now tell the reader how it all started and how it has progressed now, which is now this one. And then with the results, the MRI investigation, buttressing on that before you make your recommendation. But if it were to be an urgent case, in an urgent situation, you just have to, the case notes might not be like the one that you used. Do you understand? There might be some other visits in the past, and now there is a visit happening today now. So in an urgent situation, the visit happening today, that's the one you are bringing first as the current situation. Discuss it before you now go back to start telling the reader how the problem first started and what you've done in the past concerning this problem. When you are now done, you now move on to discuss other background information. Are there other medical conditions this patient has? Are there other medication the patient has been taking? You now bring them in before finally you make your recommendation. So it all boils down on the relevance of that information. That will determine how you organize your work. But no matter how you organize your work, the introduction will always be the first, and your recommendation will always be the last. Yeah.
Last. Okay. Thank you very much. Thank you.
All right. Thank you. Okay, that's fine. So I think what we do now, we'll go over to the nurses review. So I think we'll have to end this session and come back again for the nurses.